or maybe they are a product of abnormal cell metabolism. So, coming to the product of normal cell metabolism, we can find that these are cell metabolism of lipid, of protein or glycogen. Whenever lipid accumulates within the cell, it calls the fatty change within the tissue. You know, fatty liver. You have heard the term of fatty liver, okay? So whenever there is accumulation of lipid or cholesterol ester within the cell or tissue, it is called the fatty change or abnormal lipid metabolism. The sites of deposition of lipids are chiefly liver, then kidney, smooth muscle cells and artery, then kidney, adrenal, nerve. So these are the common organs where lipid accumulates within the body. So why there is accumulation of the lipid or accumulation of the protein within the cells? In every cells we know there is a cell membrane. Cell membrane is composed of both lipid and protein. So accumulation of lipid and protein is not critical up to the level of normal cellular metabolism. Up to the normal cellular metabolism, this lipid and this protein are essential for the cellular metabolism, are essential for the cellular own homeostasis or making own constituents of cell membrane. But as long as they are defect in metabolism, defect in storage and transport facility within the cells, defect in any enzyme that is needed to degrade the lipid or degrade the protein, so these are the circumstances where lipid accumulates within the cells. So the causes of lipid or protein accumulation within the cell is attributed to the following factor. What? Number one, লালটা ঠিক আছে, লালটা মোছা যাচ্ছে, মোছা বেশি যাচ্ছে না, লালটা দিয়েই পড়াই। So first causes are decrease in intracellular transport, defect in storage, number 3, deficiency of any enzyme, and number 4, abnormal cellular metabolism. So mostly intracellular accumulation is attributed to the following 4 causes, that is defect in intracellular transport and storage, deficiency of any converting enzyme or transporting enzyme, and result of abnormal cellular metabolism. Now defect in intracellular transport and storage is attributed by various misfolded and degraded protein within the endoplasmic reticulum. You know, within our cellular environment that is the endoplasmic reticulum or ER. It has two types of ER. One is smooth endoplasmic reticulum, another is rough endoplasmic reticulum. Rough endoplasmic reticulum, why it is called rough? Because ribosome. It is attached with ribosomes. The endoplasmic reticulum membrane is studded with ribosomes. Okay. So these ribosomes are actually meant for protein transport and protein storage as well as protein programming pathway. So if there is any defect in the protein programming pathway or ubiquitin proteasome pathway defect, so the endoplasmic reticulum is studded or accumulated with misfolded or degraded protein, that is called ER stress. You know, this is a important short note, important thing to remember in your UG level, that is endoplasmic reticular stress or ER stress. So this ER stress may lead to various conditions of protein accumulation within the cells, namely cystic fibrosis. There is defect in gene CFTR. So the protein transport and storage within the cell is chiefly harmed, chiefly disturbed, as well the result, the protein, abnormal protein will be deposited in various tissues like lungs, various tissues like skin and subcutaneous tissue, kidney, etc. So intracellular accumulation of protein is mainly due to defect in storage and transport facility of the protein by endoplasmic reticulum. So these are all about the mechanism why the intracellular protein or intracellular lipid accumulates within the cell after a certain level, so that they can disrupt the cellular metabolism and cause symptoms by doing cell injury. Now, if we coming to the deficiency of enzyme, then there are various storage disease. You know from your biochemistry days that glycogen storage disease, lysosomal storage disease, glycogen storage disease like Gauchard disease. Onjirke disease, very good. Pompey's disease, there are Colles disease. There are numerous chart of glycogen storage disease, and there are different enzyme deficiency in different cellular level for the transport and conversion of glycogen. So as a result, the glycogen accumulates within the cell, within the macrophage, and the cell injury occurs, and the patient will suffer from various disease, various symptoms. So glycogen storage disease is chiefly due to the deficiency of various enzymes. Okay, and finally the abnormal cellular metabolism is the chief part where the intracellular accumulation occurs. So everybody know the causes of intracellular mechanism, everybody know the types of intracellular accumulation. Now the clinical part. What are the symptoms, what are the signs, or what are the various pathologic manifestation of intracellular accumulation? One, we told that fatty liver, that is accumulation of intracellular fat or lipid within the hepatocyte. Okay, the hepatocytes, the protein factory of our body, these hepatocytes, if there are injury like chronic injury like alcohol dependence or alcohol abuse or various drug or pregnancy or obesity or diabetes mellitus, there are innumerable causes of fatty liver within the tissue. So whatever the lipid that accumulates beyond the capacity of hepatocytes, and the hepatocyte may be undergo the steatotic changes or steatosis. this may be reversible in initial phase, but after the certain point of time, whether there is lipid peroxidation occurs and formation of free radicals occurs, then the injury, the fatty changes, the fat steatosis is irreversible. So there is the most common type of intracellular accumulation of lipid is in our common practice is fatty liver. Okay. So fatty liver is one of the term. So what is the next thing that is result from intracellular accumulation of lipid? What are the various spectrums of intracellular accumulation of lipid? First, fatty liver. Next, cholesterosis. Third, cholasma. Fourth, atherosclerosis. So these are 4 clinical conditions where the lipid accumulation within the cell causes symptoms and causes disturbance of the patient system. Fatty liver, we have explained it. What is fatty liver? How does it occur? What are the irreversible and reversible changes of fatty liver? Fatty changes, lipid peroxidation, steatosis. Now, cholesterosis. What is cholesterosis? It is accumulation of fat or cholesterol ester within the macrophage of the tissue. Okay. So tissue macrophages or histiocytes, they appear as a foamy cells. Okay. And the wall of the various organs are studded with the foamy cells. So the patient will suffer various symptoms like GB stone, like bloating. So cholesterosis, the main organ involved in cholesterosis is gallbladder. Gallbladder wall. This is also called strawberry gallbladder. Okay. So lipid accumulation within the tissue histiocytes of the gallbladder associated with lipid peroxidation and cellular injury, that is called the cholesterosis. It is seen in the wall of gallbladder. Okay. Now the third is cholasma. What is cholasma? The same thing. The lipid accumulates within the tissue histiocytes within the macrophage and forming a tumor-like lesion. Okay, a tumor-like lesion in skin, in subcutaneous tissue, and in tendons. So cholasma is a skin and subcutaneous level manifestation of intracellular lipid or fat accumulation. It is also associated with lipid accumulation within the macrophage or tissue histiocytes. Okay, and the next more common thing is atherosclerosis. What is atherosclerosis? We know that hardening of vessels. Very good. Hardening of vessels and narrowing of the lumen of the vessels due to endothelial injury, then accumulation of cholesterol ester within the intimal wall or smooth muscle wall of the vessel. Vessel has 3 layers: adventitial layer, muscular layer, and endothelial layer. 3 layer vessels. Every vessels, the muscular artery, the thick arteries has 3 layers. The adventitial layer is the most external layer. Then the muscular layer, smooth muscle cells comprised of due to contractile ability of the artery, and the endothelial layer. The innermost layer is the endothelial layer. If any oxidation defect, any vascular injury, endogenous or exogenous toxin like smoking, like hypertension, if there is any endothelial injury, then the endothelial damage occurs, and there, due to presence of lipid within the vessel wall, due to presence of lipid accumulation within the vascular lumen, the vessels nearly narrow down and the stasis of the blood occurs, and there is formation of blood clot or microclot formation that ultimately occludes the vessel flow. So the atherosclerosis, the consequences of atherosclerosis is attributed by the various events of hypoperfusion of the tissue. Atherosclerosis, it occurs in the vessels of the heart, coronary artery, then acute myocardial infarction, acute coronary syndrome, ischemic heart disease like disease occur. Okay, if the atherosclerosis occurs in the blood vessels of our extremity, then peripheral vascular disease, gangrene, this type of disease will occur. If atherosclerosis occurred in the brain artery or the cranial artery, then the transient ischemic attack or cerebrovascular accident like incidents may occur. So these are the spectrums of intracellular lipid accumulation. Number 1, fatty liver or steatosis. Number 2, cholesteatosis of gallbladder. Number 3, chloasma of skin and subcutaneous tissue. And number 4, that is widespread disease, that is atherosclerosis. Okay. Now coming to the intracellular protein accumulation. Intracellular protein accumulation may be of two types. Intracellular protein accumulation may be of two types. What are the two types? Increased production of normal protein. Next, increase storage and production of abnormal protein. So, increased production of normal protein, what are the disease? What are the condition called, or the, that is in multiple myeloma there is monoclonal proliferation of the B cells or the cells which secrete the immunoglobulin. Among the lymphocytes, there are two types of lymphocyte. One is T lymphocyte, one is B lymphocyte. T lymphocyte is associated with cell-mediated immunity, cell-mediated cytotoxic killing, and B cell is immunoglobulin production. So, in multiple myeloma, what occurs? That is, increased amount of immunoglobulin production occurs due to monoclonal proliferation of a neoplastic cell or neoplastic B cell. So, as long as the immunoglobulin levels are normal and necessary for the body, it won't accumulate within the cell as inclusion. But whenever the production outliers the utilization, then there is accumulation of intracellular immunoglobulin occurs. That is called the Russell body. Okay. So, this is a MCQ and often asked in your exams, what is Russell body? So, intracytoplasmic inclusion of immunoglobulin, okay, and it is seen in multiple myeloma. Okay. Now, coming to the next part, increased storage of abnormal protein. I told you earlier, that is cystic fibrosis. Okay. This is a autosomal recessive disease, deficiency in a protein encoded by CFTR gene and associated with abnormal storage and abnormal transport of the protein. As a result, the defective protein residue may accumulate within the various tissues like respiratory epithelium, in lungs, in kidney, in skin, and defect in proteasome ubiquitin pathway, and also caused by ER stress. Okay. So, cystic fibrosis is accumulation of abnormal protein due to defect in storage and transport facility of endoplasmic reticulum within the cell. Okay. Now, I don't talk much about the glycogen storage disease, the deficiency enzymes, because all you know from the years of your biochemistry. Now, another part is very important for your short note purpose, that is intracellular accumulation of a pigment that is called golden brown pigment or wear and tear pigment, that is called lipofuscin. This is a result of lipid peroxidation of the cells. This is a golden yellow to brown pigment, golden yellow to brown color pigment, okay, result from lipid peroxidation or liposomal pathway defect. The common location of lipofuscin is heart, kidney, smooth muscles, etc. And it occurs due to senescence of the cells or the cellular aging. This is a pigment that indicators of cellular aging. So, the other name of this pigment is wear and tear pigment. Okay, the cell, after the working of many years, the cell finally enters into the age of senescence or period of senescence, where the cell will be aged. Then within the cell, due to abnormal of liposomal pathway defect or decreased liposomal degradation, this wear and tear pigment accumulates within the cell. The most common site is heart, kidney, liver and smooth muscle wall. So, lipofuscin is a wear and tear pigment. It is golden yellow color and it is often asked in your exams as a short note. Okay. Now, coming to the next part and very important part. So, now I say end to the topic of intracellular accumulation. Okay. So, intracellular accumulation is hereby concluded. Now, the next part, I won't make you sit longer, but the next important part is what I have been asked to teach you today, that is pathologic calcification. Okay. Pathologic calcification is an entirely new entity and it is more important than intracellular accumulation. Okay. If you go through the last year questions, last 10 years question, pathologic calcification is more important as exam purpose than intracellular accumulation. So, pathologic calcification, please do listen. Pathologic calcification is of two types. Number one is dystrophic calcification and number two is metastatic calcification. What are the two different concepts? I told you, I will tell you, but please do remember that pathologic calcification is of two types. What is calcification? That is accumulation of calcium salts within the tissue, within the cells, and whenever it is causing any pathology or as a result of any pathologic process, then it is called pathologic calcification. Okay. It is mainly of two types. Number one is dystrophic calcification and number two is metastatic calcification. So, what are these? Just for a mnemonic purpose, dystrophic calcification is starting with D. So, D for dead tissue. Okay. So any calcification occurs within the dead tissue after the formation of necrosis is called dystrophic calcification. Okay. So D for dystrophic calcification, D for dead tissue. Okay. So this way you should remember that any calcification that occurs in cells or in tissue after the cell death, the cell undergo necrosis, then within the necrosed tissue there is intracellular accumulation of the calcium occurs. That is called dystrophic calcification. Okay. Now metastatic calcification, starting with M. So this is a metabolic defect. Metabolic defect of calcium production and calcium resorption and increased calcium formation. So there is metabolic derangement of the calcium levels of our body. So D for dystrophic calcification, D for dead tissue, and M for metastatic calcification, and M for metabolic derangement of calcium metabolism or metabolism defect, metabolic defect. So dystrophic calcification, we won't get any value abnormal of calcium and phosphorus in our tissue. Okay. But in metastatic calcification, the blood or serum calcium level, blood or serum phosphate level may be increased and must be deranged in terms of calcium and phosphorus level. Okay. So in dystrophic calcification, there is no metabolic derangement and the blood or serum calcium level, serum phosphorus level will be same, not deranged. But in metastatic calcification, the serum calcium and serum phosphorus level will be deranged. What are the various causes of metastatic calcification? The causes which leads to increased calcium production, the causes which leads to increased phosphorus production, the causes which are creating imbalance of calcium and phosphorus metabolism. So the conditions are hyperparathyroidism. Okay, there is a disease of increased hyperparathyroidism, that is increase in parathyroid hormone production. Parathyroid is a small gland just located adjacent to the thyroid. So it has intrinsic ability to engage calcium transport and formation of calcium and metabolism of the calcium. So in hyperparathyroidism, due to increased production of calcium or decreased secretion of phosphorus, so calcification occurs in various tissue, in bone, in kidney, in gut mucosa, everywhere. So hyperparathyroidism is number one cause of metastatic calcification. Next cause of metastatic calcification is Paget disease of bone. Paget disease of bone is also attributed due to calcium metabolism derangement, due to increased resorption of bone. There is a balance of production by the osteoblast and resorption by the osteoclast. Wherever there is imbalance between these two activity, like osteoblastic activity and osteoclastic activity, whenever there is increasing bone resorption occur than that of bone formation, in that scenario metastatic calcification occurs. That is calcification, the calcium stored and calcium deposits in skin and subcutaneous tissue, in and around joint and within the bone. So these are all abnormal, all metabolic derangement. Another cause of metastatic calcification is chronic renal failure due to retention of phosphorus. Okay. So in chronic renal failure, due to retention of phosphorus, there is an metabolic derangement of calcium and phosphorus metabolism. Okay. So dystrophic calcification is the result of cellular death and necrosis. It can occur in anywhere. It can occur in brain, after liquefactive necrosis. It can occur in papillary carcinoma after the destruction of the papilla. It occurs within the gut mucosa after the destruction of the gut epithelium due to some exogenous or indigenous injurious agent. But in metastatic calcification, namely, these are the results of metabolic dearrangement, and the metabolic dearrangement occurs in various diseases that I told you earlier, namely Paget disease of bone, okay, hyperparathyroidism, okay, chronic renal failure, and lastly I forgot, that is multiple myeloma or metastatic carcinoma in bone. In metastatic carcinoma or multiple myeloma, there are lytic lesion in the bone occurs, okay. Lytic lesion in the bone occur, as well as the cell death also occurs. The cancer cells, they are also attributed to the increased tumor turnover or increased calcium production within the cell. So the patient of cancer usually they comes to you with increase in serum calcium level, increase in serum uric acid level due to increase in cellular turnover, more cells, more cell turnover. What is cancer? That is neoplasia, that is uncontrolled proliferation of cells, okay. So if uncontrolled proliferation of cell occurs, then uncontrolled metabolism of the each cell occurs, and as a result of the each cellular metabolism, increase in calcium, increase in uric acid occurs. So in cancer or metastasis or in multiple myeloma bone lesion, increased turnover of the calcium occurs due to derangement of the cellular metabolism. So there are namely four diseases which are attributed to the metastatic calcification, that is Paget disease of bone, hyperparathyroidism, chronic renal failure, and multiple myeloma or bone metastasis, okay. So these are all. I deliberately didn't come up with a PowerPoint presentation for the same topic, as because I know that very less people will